Hello, everyone. My name is Jillian Poles, and I'm a researcher at NYU Langone Health. And today I'm going to be briefing you on physical activity as a vital sign. But first, let me give you a little bit more on my background. Before I ended up at NYU, I got my bachelor's in exercise physiology from the University of Miami, and then I went on to get my master's in exercise physiology from UNC Chapel Hill with a focus on cardiometabolic health. Another pertinent detail to know about me is I have been lifting weights for about a decade now. I started when I was a sophomore in high school, and now I am a third-year PhD student, so you can kind of do the math. And I am very, very passionate about encouraging everyone to find their form of movement that they enjoy so that they can remain healthy and physically active. So my qualifications are that I worked for about 3 years as an American College of Sports Medicine certified personal trainer, and now I am a competitive powerlifter. So I feel very, very passionate about this, and I'm very excited to explain it to you today. In this video, I will be explaining physical activity as a vital sign, or PAVS. And if I've done my job right, by the end of this video, you should understand the PAVS initiative and why it is important. You'll understand how to implement PAVS one-on-one with a patient in the clinic. I will also be giving you the national guidelines for physical activity for promoting general health. I'm going to run through physiological benefits of exercise. And finally, I will explain some basic elements of behavioral theory. And this will help you understand your patient's motivation and how best to maximize adherence to an exercise plan. So I'm going to first give you an overview of PAVS and explain why it is important. And hopefully by the end, I will have convinced you too that physical activity is as important a vital sign as any other. Recent efforts such as the American College of Sports Medicine Exercise is Medicine Initiative and the Surgeon General's Step It Up program have aimed to encourage the medical community to promote physical activity as a means for disease treatment and prevention. And in order to promote physical activity and know when it's appropriate and how much or what type, we first need to ask our patients how much physical activity they are currently performing on average. And data like this can be obtained just like the other vital signs, because what is a vital sign other than a general indicator of physical condition? And if we don't ask our patients how much physical activity they're completing, depending on the patient, of course, we could be missing a vital piece of the puzzle in terms of either managing chronic disease or preventing it. So the national guidelines that are widely accepted for general health dictate that an individual should complete at least 150 minutes of moderate intensity exercise or 75 minutes per week of vigorous intensity exercise, or some sort of combination of the two, or it can be performed in separate bouts, etc., etc. That's just 2.5 hours out of a 168-hour week. Pretty good. However, according to the CDC, as of 2008, less than 10% of Americans are meeting that physical activity guideline. And so if you're a practitioner in the United States, you have more than likely had a patient come through your clinic and they are not meeting these guidelines. But the real question is, did you know whether they were meeting these guidelines? In a study of 261 participants in the Utah Health Research Network, BMI was 0.91 lower for each additional day of moderate physical activity reported on PAVS, and that P is less than 0.001. Furthermore, BMI was 2.9 lower in participants reporting moderate physical activity 5 or more days in a typical week, compared to individuals completing less than 5 days. Intermountain Healthcare performed a cross-sectional study of a whopping 34,712 participants. And they found that compared to those who are meeting physical activity guidelines, those who do not meet those guidelines were 1.77 times more likely to have greater disease burden, as well as 1.19 times more likely to have a BMI classified as overweight. So hopefully you're kind of getting a picture of why it is important to ask our patients about their physical activity. So your next question may be, well, what does moderate physical activity look like versus vigorous physical activity? So my general rule of thumb to distinguish between moderate physical activity and vigorous physical activity is called the talk test. So picture yourself doing some sort of activity. Can you hold a comfortable conversation while doing it? Yes, it's going to be light to moderate. No, you've entered vigorous territory. So examples of moderate physical activity can include a brisk walk, a slow bike ride, and even things like active home chores and gardening. Examples of vigorous activity include maybe a fast jog, a fast bike ride, swimming laps, doing singles tennis, doing an exercise class at your favorite gym. And this brings up a great point. Let's make sure that we can distinguish between physical activity and exercise. I mentioned active home chores as a form of moderate intensity physical activity. It may not be exercise, but it still is physical activity. And I think a huge key in exercise promotion, especially for those just starting out, is my favorite mantra: all movement is good movement. And so it doesn't really matter if, you have a planned bike ride with your friend or you just have a lot of gardening to do. Both can be viewed as moderate intensity physical activity. And I think that's really important because things like walking your dog throughout the day can actually add up to help you meet those 150 minutes per week. And in addition to the basic 150 minutes of moderate activity and 75 minutes of vigorous activity, the American College of Sports Medicine has actually added kind of a bonus criteria, if you will, which is that adults should be performing muscle strengthening activities that are moderate to high intensity and involve all major muscle groups on 2 or more days per week. So hopefully now you are super excited about physical activity as a vital sign, and you are also probably wondering what kind of questions we can ask our patients to assess physical activity level. According to the CDC, you can ask your patients, how many days during the past week have you performed physical activity where your heart beats faster and your breathing is harder than normal for 30 minutes or more? And you can also ask, how many days in a typical week do you perform activities such as this, since we know that physical activity can definitely fluctuate depending on certain personal circumstances. So it'll only take you an additional 30 seconds on top of what you already do to administer PAVS and have an understanding of your patient's physical activity level. Why wouldn't you? If I haven't convinced you of the importance of PAVS yet, let me keep trying. I'm going to go ahead and run through the physiological and psychological benefits of physical activity. Firstly, we have improved cardiovascular, immune, and respiratory function. We have reduced risk of coronary artery disease specifically, as well as its common comorbidities, including dyslipidemia, prediabetes, and hypertension. We see decreased fall risk, which is especially important in the elderly, where hip fractures can be deadly. And going along with this, you also see improved bone health, specifically increases in bone mineral density, which can prevent those fractures, prevent osteoporosis and osteopenia. You also see an increase in resting metabolic rate, which is also important with age and important in cases of loss of lean muscle mass. And of course, psychologically, we always hear endorphins, endorphins, endorphins. What does this lead to? Decrease in anxiety and depression, enhanced feelings of well-being and competence. It has a positive effect on stress and can even improve cognitive function, which once again is important in older adults, especially to stave off Alzheimer's and dementia. Now, I appreciate those of you who are excited to implement this in the clinic, but before we go running and prescribing exercise to our patients, it's important to also understand what we call risk stratification. And so there are certain cardiovascular risk factors that may actually cause an individual to require medical clearance prior to any exercise. So I can tell you kind of from the other side, us personal trainers, or at least the American College of Sports Medicine certified personal trainers, learn these risk stratifications because for us, this means that if we see a red flag, we actually refer the patient out to a doctor like you. And they have to obtain medical clearance prior to any exercise. So I'm going to list a bunch of cardiovascular disease risk factors. And keep in mind that if you have at least 2 of these risk factors, you are automatically considered high risk. So the first risk factor is age. And so if you are a male of at least 45 years of age or a female of at least 55 years of age, that is considered a risk factor. We also have family history. So if you have a first-degree relative who has experienced a cardiovascular event. We have obesity, and that can be determined by a bunch of metrics. You can have the BMI, obviously. Hopefully we're moving away from that, but BMI of at least 30 is considered obese. And you can also use the waist circumference. So for men, that's greater than 102 centimeters. For women, it's greater than 88 centimeters. You could use the waist to hip ratio, which I don't personally love as a metric, but that would be greater than 0.95 for males and greater than 0.86 for females. Another risk factor is hypertension, of course. So we have systolic of at least 130, diastolic of at least 90, or if they're on any sort of blood pressure medication. Following that, we have dyslipidemia, so an LDL of greater than 130 mg per deciliter, an HDL of less than 40 mg per deciliter, total cholesterol of at least 200 mg per deciliter, or on any sort of lipid-lowering medication. We also have diabetes and pre-diabetes. So for pre-diabetes, that would be a fasting blood glucose of at least 100 mg per deciliter. Full-on diabetes is 125 mg per deciliter. Another one is smoking. So if you have a current smoker or someone who has just quit within the last 6 months, that is positive for that smoking risk factor. And of course, the thing that we're talking about today, sedentarism. And so according to the American College of Sports Medicine, that would be classified as less than 30 minutes per day of moderate intensity exercise for 3 days per week for 3 months. 3, 3, and 3. Easy to remember. Another simple way to determine if someone is high risk is if they exhibit any signs at all of chronic cardiovascular, metabolic, and or pulmonary disease. And so these can include pain or discomfort in the neck, jaw, arms, or other area. The assumption is that there may be some ischemia there. Shortness of breath at rest or with mild exertion. Difficulty breathing while laying down or even sleeping, ankle edema that is not due to an injury, heart palpitations or tachycardia. Remember, we're not as worried about bradycardia because it's possible for a very aerobically trained individual to have a resting heart rate lower than 40, and it just means that they have become very efficient with their stroke volume. Intermittent claudication, heart murmurs, and just unusual fatigue, which usually comes with that shortness of breath. So a low-risk individual is someone who meets the criteria for 1 or less risk factors, and they will not need medical clearance prior to participating in any exercise. A moderate risk individual will meet the criteria for 1 or more of those cardiovascular disease risk factors, but they won't have any of those signs and symptoms. And those individuals will probably need medical clearance prior to vigorous exercise, but not moderate exercise. Finally, your high-risk individuals are those who meet 2 or more criteria for cardiovascular disease risk, and or they have 1 or more signs and symptoms of the ones that I listed. And those individuals will need medical clearance prior to participating in any exercise. And they also could benefit perhaps from a graded exercise test on either the treadmill or the bike ergometer, and that should be supervised by a physician. So what happens when our patients are totally new to exercise? They don't even know what kind they should do. They've never really participated in anything before. How do we help them find their way? First, I want to educate you on kind of the differences in adaptations that we achieve from different forms of exercise, and hopefully that will help you understand who to prescribe what to. So the types of exercise are often kind of split into 2 categories, being aerobic and resistance. And I want to just stop right there and say that I think that's a bit of a misnomer. I think that operates under the assumption that all weightlifting or resistance training type stuff is considered anaerobic, and that is just not true. So I just want to put that out there, that you can also get aerobic cardio benefit from weightlifting. As I mentioned before, the American College of Sports Medicine advises that people perform both aerobic, I'm going to use their terminology, aerobic and resistance activity. You can think of the aerobic stuff as like your cardio. Why do they recommend both? It's because resistance activity can be crucial for a number of health metrics. So often the goal of resistance training is to either maintain or gain lean muscle mass. But why? What does this do for our health? Muscle is what we call an energy sink, and we don't mean that in a negative way. It's just very metabolically active, and more metabolically active than your subcutaneous fat. So an individual with a higher lean muscle mass will have what we call a higher basal metabolic rate, or the amount of calories that you're burning at rest. So that's great for an individual who is trying to lose weight. In terms of cardio protection, I mentioned that both forms of exercise can help with this, and I'll tell you why. They help with different adaptations that kind of lead to the same results. So our cardiac output, as you probably know, is usually constant around 5 liters per minute all around our body, and that should be kept constant, otherwise bad things are going to happen. So our cardiac output is the product of our heart rate and stroke volume. Therefore, our heart rate and stroke volume are inverse, which makes sense. Heart rate is the number of beats per minute, whereas stroke volume is the amount per beat. So the amount that your heart is ejecting every time that it beats. So what is ideal is we decrease our resting heart rate, and that actually decreases the fatigue of our myocardium. So your cardio activities and your weightlifting achieve this in 2 different ways. When you're performing aerobic exercise such as running, your heart is receiving what we call a volume overload. It's receiving a larger volume in venous return than what it is used to at rest. Makes sense, we're running. This volume overload over time causes non-pathological thinning of the ventricular wall. It is not dangerous unless in really, really extreme cases, but I have never heard of a case such as that. What it does is it actually just makes the ventricle larger inside, and that allows for more blood to exist in the ventricle. What does this mean for us? Well, we know, think back to your Cardiology 101, we have the Frank-Starling mechanism. A more optimal overlap of the sarcomeres in the myocardium means that our heart can pump out more blood. That means we have a higher stroke volume and therefore a lower resting heart rate. So that explains why athletes like Michael Phelps are gonna come off probably bradycardic on the EKG, but it's not a concern at all, and it's very much the opposite. Resistance training, on the other hand, is going to achieve this in a different way. It has what we call a pressure overload, and that causes non-pathological kind of thickening, little hypertrophy, often left ventricular hypertrophy, but non-pathological left ventricular hypertrophy, I must emphasize. And this, again, allows for greater contractility because same principle with like a bicep, you have hypertrophy, greater cross-sectional area usually correlates to greater power output, and in this case it does, so you have a greater stroke volume. Both are great in different ways. When you combine them, you would think they would kind of cancel each other out, but they don't. They actually cause something called eccentric left ventricular hypertrophy, where the wall is both thinner on the inside and thicker on the outside, again, non-pathologically, and you get this beautiful increase in stroke volume. So most of the time, you don't have to worry about telling a patient to do one or the other. In fact, it's fine if a patient just wants to do cardio or aerobic, whatever you want to call it, or a patient just wants to do resistance. But are there cases where a patient could benefit more from one or the other? Of course. So cases like that could be, for example, osteoporosis, osteopenia, etc. You want them to perform some sort of resistance training because that's going to help build up bone mineral density and therefore prevent fractures. In individuals in larger bodies, it may be more difficult to run on higher impact surfaces. So a good solution for that, if they still wanted to perform aerobic cardio training, is swimming. But they can also be performing resistance exercise, and that helps to increase the basal metabolic rate. If someone is tachycardic, you're going to want to start them slow, but it could be good to have them do some aerobic exercise to try to decrease the heart rate. So we can take what we know about these adaptations from each form of exercise, and we can use them to inform our recommendations to our patient. So to start off, understanding how we can promote behavioral change, I want to teach you something called the Transtheoretical model of change. And it sounds a lot more complicated than it is. It just dictates that there are 5 stages of change that people go through when they are trying to implement a new behavior. And so these include pre-contemplation, contemplation, preparation, action, and maintenance. So starting at the top with pre-contemplation, those are your patients who don't really have exercise on their radar. They're not considering it. They're not taking any action. But hopefully you can take those patients, use physical activity as a vital sign, and educate them on the benefits of physical activity or the risks of not performing physical activity. And hopefully you can help push them into the next stage, which is contemplation. And so that is where your patient is kind of considering the negative consequences of not making a change, considering the benefits of making a change, and they're considering making that change within the next 6 months. So this time in the contemplation stage, those maybe 6 months, are a crucial time for you as a practitioner to keep encouraging and educating your patient towards implementing physical activity. So I fully encourage passing on all of the information that I've given you in this video to your patients to help them understand why it is important to keep fighting the good fight and really make it a habit. And so if you've succeeded, which I hope you will, your patient will be in the preparation stage. And so that is where they are developing a plan of action, and they intend to implement it within the next 30 days. So now you've done a great job of educating your patient and or providing them with the resources to educate themselves on the importance of physical activity and how they may meet those national guidelines. And so that pushes your patient into the action stage where they are actively making changes. And so finally, you and your patient have worked as a great team to make sure that they have the resources at hand to perform exercise that they enjoy and they know that they can adhere to. But maintenance is actually not considered until the patient has been actively doing these changes for 6 months. And so that is where things can get difficult. Often, we go to the gym and we're trying to lose weight and we don't see those changes right away. And we have gym intimidation, or we're comparing ourselves to others, or we don't have a great sense of self-efficacy because we don't know how to use the machines, or whatever it is. These are things that everyone experiences, and these can be barriers to continuing physical activity. And this is where it could be helpful to kind of interface, keep following up with your patient and ensure that they are able to execute that plan, that they're enjoying it, and they think that they can adhere to it. So maintenance highly likely will require something we call intrinsic motivation. We have extrinsic and intrinsic motivation, and often we do start with that extrinsic motivation. So that can be something like weight loss or appearance, and these are fine. These can be great to, motivate and educate those short-term goals. There's nothing wrong with that. But to really adhere to it for 6 months, you're going to need something stronger, and that would be your intrinsic motivation. And so things like that are this sense of accomplishment after every workout, this enjoyment of exercise. That's probably the biggest thing. You need to enjoy what you're doing. Otherwise, I promise you, you will not keep doing it for the rest of your life, nor should you. And also just sense of self-efficacy can feel really good, I learned how to do this new thing, and now I feel confident doing it, and I can do it often, and it's helping me reach my goals. That all is really, really good for your intrinsic motivation. Additionally, and it may seem obvious, but an individual who perceives that the benefits outweigh the risks of exercise is far more likely to adhere to that exercise plan. So what can you do here? You can maybe during that preparation or contemplation stage, even pre-contemplation, have them make a pros and cons list or have them make a list of barriers and benefits. And you can sit down together and discuss maybe how you can overcome the barriers or how they can see that the pros would outweigh the cons. Other things that you can do as a practitioner during the process is involve them in the planning stage. Don't just prescribe them exercise. Make sure that you understand what exercise they've maybe done in the past that they've enjoyed, what exercise they've done in the past that they have not enjoyed, and make sure you tell them that they never have to do that again. It's also helpful to help patients self-regulate and self-monitor, and this will also bring them towards that autonomy in the maintenance stage. Ensure that they are understanding their progress and maybe how to monitor it. For example, maybe if your goal is to lose weight, do not step on that scale every day. You will torture yourself. It's just, there's such fluctuations due to water weight and so many factors. Maybe start by weighing once a week, and that's a great way to self-monitor and slowly start to become autonomous. And finally, as I kind of mentioned briefly before, self-efficacy is key. Self-efficacy is the belief in one's capability to perform something, to achieve a goal. If your patient doesn't think that they can achieve the goal, it's going to be more difficult for them to want to achieve that goal. So make sure that your patient is informed and confident and has all the resources that they could need to really get into that last maintenance stage. So I mentioned a couple times how important it is to keep following up with your patient and keep an open line of communication when forming an exercise plan and maximizing adherence. But how on earth do we do that? I'm going to introduce you to another model of behavioral change known as the 4A's model. And that stands for assessing, advising, agreeing, and assisting. So first we want to assess the patient's beliefs, motivations, and behaviors. And this can come in handy in that kind of pre-contemplation stage when you want to get them into contemplation. So get them starting to think about implementing exercise in their daily life. But to understand this, you need to know their motivations. What would they gain from exercise? And sometimes it's something extrinsic, like I just want to lose weight or whatever it may be, and that is totally fine. And make sure the patient understands their own motivations, and that increases the probability that they will move into the contemplation stage. Next, you can advise the patient based on health risks and behaviors. And so this is when that risk stratification comes in, either through cardiovascular disease risk factors or those signs and symptoms of disease that I mentioned. This is where you can kind of assess that and then explain what that means to a patient. What does a systolic blood pressure of over 130 mean for them? And why should they care? So now that you understand the patient and the patient understands you, it's time to agree on realistic short and long-term goals. And these goals should be SMART goals, and that stands for specific, measurable, attainable, relevant, and time-bound. And so you don't want something just, I want to lose weight. Okay, in the short term, let's say over the next few months, how much weight do you want to lose? Like, how do you want to do it? Et cetera, et cetera. It has to be more specific. Essentially, you want to be able to ask very easily, did you accomplish this goal? And it's either a yes or a no. And finally, you want to assist the patient with anticipating barriers and developing a specific plan. So that is during your preparation phase. Barriers, you want to help kind of work with your patient, ask them, maybe what's currently stopping you from exercising consistently or performing consistent physical activity. And you may find out things that you never would have known if you didn't ask. Maybe the patient wants to be able to walk, but they don't live in a walkable area, or they don't feel safe, or, you know, there's a gym right near them, but the membership is too expensive. Or what barriers will there be in the future? You know, time to cook for themselves and make sure that they are eating nutritiously might be difficult. All of this should be discussed and anticipated before the preparation stage, because in making a plan, you need to consider all of these barriers. And so these 4 A's are going to be crucial in helping your patient really understand what needs to be done. So hopefully now that we reached the end of this video, I have convinced you that physical activity is just as important a vital sign as any other. And hopefully I've convinced you to include it maybe even in your electronic medical record. I also hope that I've equipped you with enough knowledge and resources to assess your patient's risk and see how and why exercise might benefit them, and how to educate them on the same, how to set goals, how to achieve them, and how to maintain lifelong adherence. And if I've done all that, I can rest easy. Thank you so much for watching. Please check out the rest of the Rupa Health videos on this YouTube channel, as well as the Root Cause Medicine podcast.
Welcome to Rupa Health, the best place to order, manage, and track results from over 30 different lab companies in one single place for free. It's going to take you under 2 minutes to sign up, and you can order any functional medicine lab for your client in under 30 seconds. Let me show you how it's done. So here's our beautiful interface. I'm typing in the name of my client, selecting the lab that I want to order for them, and hitting send. From there, Rupa and their amazing team handle the rest. They email the client, collect payment, and even offer an interest-free 3-month payment plan. We've also built the world's largest library of information about chronic health conditions, the lab tests that can help you find the root cause, and the evidence-based interventions that you can use to help people heal from them. It's called the Rupa Health Magazine. There, we have in-depth articles about almost any health condition you can imagine. And we give you step-by-step protocols that other clinicians have used to help their clients heal and that are verified by evidence-based sources. You should totally check it out, and it'll transform your practice. And we can't wait to see you. So make sure you sign up today at rupahealth.com.